What does it mean when someone says the patient is bucking the vent? So this term is a slang term. This is not like a technical medical term or anything, but it is something that you'll commonly hear in the ICU whenever a patient is not really syncing up with the vent. Now, this can mean a lot of things to different people. So these are some of the most common things it might mean. The patient might be coughing and it's like triggering the vent's alarming. Could be gagging on their tube. They could be breath stacking, aka the ventilator I can't speak. AKA the ventilator takes a breath for the patient and then they decide to take a breath on top of that. Could just mean that the patient is super, super agitated. And so they are constantly triggering the high pressure alarms. They're coughing. They're like moving all over the place, clearly not tolerating the current vent settings or sedation that the patient is on. So, what do we do about this? You're not going to like my answer, but truly it depends. Most nurses are going to say, well, increase the sedation, but truly we don't want to increase sedation unless we have to. Yes, we want patients to be comfortable. We don't want them to be in pain. We want them to tolerate being on the ventilator. But if someone's just randomly coughing and then it goes away, or maybe they like woke up for a bit, kind of gagged on their tube, but then they fell back asleep, we don't want to automatically reach for like, let's sedate the patient. Of course, if it's an emergency, your patient's desatting, they're showing other signs of not tolerating being awake, bucking the vent, then yes, we would resort to sedation. I like to start by just literally talking to my patients, explaining to them what's going on. Like, you're awake, you've got a tube in, you're in the hospital. That tube can make you cough sometimes, or it might make them gag. Like, I try to kind of verbally talk the patient through what is going on. Sometimes we may need to change up the vent settings for the patient. They're just not really syncing up with the vent. They are asynchronous with the ventilator. But that is what it means to buck the ventilator. Let me know if it means something different where you work.